Hello everyone, I hope everything is going well with you. This is our second lecture. As we have taken in our first lecture the medical terminologies and how to divide them into prefix, root, and suffix, and we have taken the most common prefixes, roots, and suffixes, which will help you during your study and during this course. Today we will take in the second lecture the body parts and some medical terminology related to pathology. What is the meaning of pathology? As we said last time, the root patho means pain and logy means study. So pathology means the study of pain. We will take, of course, and diseases. We will take today uh, some medical terminologies related to pathology, diseases, the symptoms, and signs. All right, so let me share with you the material, the body parts. Parts of the body. We have here English names for the body parts, and we have anatomical names. We have English names, which are common in general English, and we have anatomical names that are for specialized people who are the doctors. Here we will take the English names and we will take some of the anatomical names. We have, this is of course not a detailed picture, but we will take the most common body parts that we can use during this course, uh, because I don't know you have taken anatomy or not. So these are some of the very general and common body parts. Number one, we have jaw, and the anatomical name is mandible. We have neck, shoulder, armpit, and the anatomical name is axilla. We have upper arm, elbow, back, buttock, wrist, rest, the W is silent, thigh, calf, leg, chest, or thorax. We have breast, stomach or tummy, and the anatomical name is abdomen. We have navel, and the anatomical name is umbilicus. We have hip, groin, which is in inguinal region. We have knee, which is in the anatomy called patella or kneecap, and we have shin. All right. These are some of the very general body parts that I think that most of you know them already. Here we have the limb. The B is silent, so we say limb. Limb means arm. We have, for the limb, we have upper limb and we have lower limb. The upper limb refers to the arm, and the lower limb refers to the leg. Uh, and the trunk. The trunk is the body excluding the limb, the lower limb and the upper limb. Oh, okay, so we have the trunk is the main body excluding head and limbs. All right, so here, how do the patient how does the patient refers to his pain or her pain? They can say, for example, I'm having trouble with. I'm having trouble with. Right? So they say, for example, I'm having trouble with my hip, my shoulder, my knee. Right? The doctor, when the doctor need to ask about the body part, they say, do you have pain? Do you get any pain in? Do you get any pain in? So we have trouble with, and you have pain in. All right? Do you get any pain in the chest, the stomach, the back, right? Or your chest, your stomach, your back. Number C, describing radiation of pain. What is the meaning of radiation of pain? Radiating pain is pain that travels from one body part into another body part. What is the meaning of this? When, for example, you have pain in your neck and this pain goes into, for example, the back, for example. So you have pain in somebody in a body part, and this pain it spreads. What is the meaning of spread? It goes into or travels into another body area. So this is called radiation of pain or spread of pain from one body part to another body part. All right. So, describing radiation of pain when a patient is telling the doctor about um, pain that travels or radiates into another body part. A patient is telling the doctor about his back pain and the parts of the body it radiates to. So, we have here radiates to. The preposition with radiate is to. It starts in the back. It here refers to pain. The pain starts in the back, then it seems to go into. It seems to go into. So we have here start in and then go into the right buttock and down the back of the right thigh to the knee. So we have here that his pain starts in the back and then it seems to go into the right buttock, all right, and the back of the right thigh to the knee. So his pain is going downward from the back to the buttock to the knee, all right. Okay. Write the ordinary English words for the corresponding anatomical terms in the table using your medical knowledge. Here we have some of the anatomical terms and we will say the common English word. For example, we have abdomen. The common word is stomach. And we have axilla. The common word is armpit. We have the third one, carpus. The common word is rest. Coxa. The common word is hip. Capitis. The common word is elbow. Mama. The common word is breast. Breast. Knees. The common word is buttocks. Buttocks. Patella. The common word is knee cap. All right, let's move to number 2. Before going to the second exercise, I wanted to write for you the answers that I said. We said abdomen means stomach, axilla means armpit, carpus means wrist, coxa means hip, capitis means elbow, mama means breast, knees means buttocks, and patella means knee cap. Let's answer number 2. Complete the sentences using ordinary English words. We will use the ordinary English words, not the anatomical ones, all right? Look at A and C to help you. We have here A, which are the body parts, and we have C, describing radiation of pain, right? In order to say that the pain starts, for example, in the back and it seems to go into, right? And to say that then it it goes, for example, down or it goes up. All right. So let's move here to this exercise for a male patient describing angina, describing angina pectoris. So what is the meaning of angina pectoris? Angina pectoris means in Arabic ذبحة صدرية. Alright, so so angina is any attack of painful spasm characterized by sensation of choking or suffocating. Alright, so here the main pain will be in the chest. Alright, for the angina pectoris, the main pain will be in the chest. Alright, let me write for you the meaning of angina. It is any attack of painful spasm characterized by sensation of choking or suffocating. All right. So here it's like a tightness across my. We said that for this um, for this problem, the first thing that the patient will feel, he or she will feel a male. So he will feel the first thing, a pain in the chest. So it's like a tightness across my chest, and then it goes up. It goes up into here as this one. It goes into, all right, and you say it goes into my, and you say another body part where the pain spreads to, or where the pain radiates to. It goes up into my. So from the chest, we can say that it goes up into my neck, for example, or you can say my jaw, all right? And into my left shoulder. And into my left shoulder. And what? The left what? So you can say and down the left arm. All right, so it's like a tightness across my chest, and it goes up into my neck, for example, and into my left shoulder, and down the left arm. All right, so let's here move to number B. A male patient describing renal colic. So we said last time, what is the meaning of renal? We said last time that ren, the prefix ren or reno means kidney. The prefix ren means kidney or pertains to kidney, and al means pertaining to or related to. So renal means pertaining to or related to the kidney. So this patient is suffering from renal colic. Colic means pain that comes mainly to the stomach. All right. To of course the stomach and the intestines So here it starts, we say that the pain starts in the loin and goes into the, what is the closest region to the loin? The closest body part to the loin is the groin. So it starts in the loin and goes into the groin, and what into the testicle it will be, and down into the testicle, and down into the testicle. All right, complete the sentences. Look at a opposite to help you. Here we have anatomical term, and we will try to guess what is the statement of the patient using the common English words, all right, instead of using the anatomical term. We have here number one, inguinal swelling. Inguinal swelling, the patient will say, I've got a lump in the groin. I got a lump in the groin. Because as we see in the first picture, groin in the anatomy called inguinal region. All right. Number two, abdominal pain. My little boys got a stomachache. Stomachache is one word, all right? So there is no space between stomach and ache. So abdominal means stomach ache. Stomachache. As you can see, there is no space. It's just one word. Number three, pre-umbilical rash. Pre-umbilical rash. So, as we have taken in the last lecture, what is the meaning of the prefix pre? The prefix pre means around. The prefix pre means around. Pre-umbilical, pre-umbilical. Here, umbilical is the adjective from umbilicus, all right? So, around the umbilicus rash. Umbilicus refers to the navel, all right? So here I've got spots around my navel. Number four, thoracic pain. Thoracic pains come from thorax. So, and thorax is the anatomical name for chest. So, I've got a pain in the middle of the chest. Enlarged axillary node. Node here, what is the meaning of node? Node means swelling. Node means swelling. So, enlarged axillary node, there is a painful swelling in my armpit. Because as we have taken in the first page, armpit, the anatomical name for armpit is axilla. Mandibular pain. As we have taken, mandible means jaw. So I've got pain in my jaw. All right, let's move to number 4. Complete the table with words from the box. The first one has been done for you. For example, we have here trunk means We have in the trunk, the abdomen, we have trunk, we have upper limb, and we have lower limb. As we have said, upper limb means arm and lower limb is leg. So here we have abdomen. What else do we have in the trunk? I, of course, suggest for you to answer this question and to give yourself just 1 minute to answer it, then continue the lecture. We have the trunk, we have abdomen, we have loin, and we have chest. In the upper limb, we have elbow, and we have wrist, arm, and finger. For the lower limb, we have thigh, knee, and leg. All right? This is the first lesson. So in the first lesson, we have parts of the body, and we have taken the English names, and we have taken the anatomical names. All right, and here, as we have taken this picture, these are the most common body parts that you will use. Then we had here how the patient refers to the body part where he or she has a problem, and we have number C, describing the radiation of pain, and to describe how the pain starts in a specific body part and went to or goes to another body part. Then, in the next page, we have taken some of the anatomical terms and the common terms. Some of them are already here in the picture, and some of them are new. Like, for example, coxa means hip, and so on. And then here, two of the exercises that are similar to the one we have taken in number C. Some new words are presented, like, for example, angina pectoris, and for example, some of them, they are common, like renal colic, and they are common because of the first lecture where you already understand what is the meaning of renal. All right. Here we have the anatomical term and the patient statement. All right, and here how to divide the body parts into trunk, upper limb, and lower limb. For this exercise, it's an easy one, so I leave you answer it alone at home. Here you will say, for example, the abdomen. You say the abdomen is related to the arm, hand, leg, foot, torso, or head. Of course, the abdomen is related to the torso. So it's an easy exercise. For example, Achilles tendon, this is the tendon joining the calf muscle and the heel bone. All right. Let me write it for you. Here, it's the tendon joining the calf muscle and the heel bone. All right. This is, of course, a new word for us. So when I say the tendon joining the calf muscle and the heel bone, where is this? Of course, it's in the foot. The ankle, for example, is in the foot. Buttock, the buttock is in the torso, because torso equal trunk. Torso equal trunk. And we have, for example, the calf. The calf is in the leg. We have chest is in the torso, and so on. All of these words, they are common words, or they are words that we have already taken in this um, lesson. We have the new words are only the word soul. What is the meaning of soul? Sole is the bottom part of the foot. The bottom part of the foot, right? This is the meaning of sole, the bottom part of the foot. And we have the word temple. What is the meaning of temple? The temple is the side of the head behind the eyes, all right? The side of the head behind the eyes. Okay, so this is for this exercise. Let's move now to the symptoms and signs. The first thing that comes to our mind when you read this title, the symptoms and signs, what is the difference between symptoms and signs? The problem which a patient reports to the doctor are called symptoms. So when the patient goes to the doctor saying that they have, for example, a back pain or stomach ache or headache or whatever, these are called symptoms. All right. For example, here pain and nausea. So nausea is the feeling of sickness in the stomach, all right? It is a feeling of sickness in the stomach. So these are the symptoms. Like, for example, the patient goes and says to the doctor, I have pain in the back, I have nausea, and so on. Signs are what the doctor finds, all right? That's why they are called finding. After examining the patient. So after examining the patient, if for example the doctor finds out that the patient has high blood pressure or rapid pulse rate, these are signs. They are signs to a specific disease, for example. So they are called signs or findings. And the symptoms that the patient suffer from, they are called symptoms or complaints, right? So here, for example, Mr. Farnsworth was admitted complaining of chest pain, right? In case notes, the abbreviation CO is used. What does CO mean? As we said, it means complaining of, right? So in the case note, the the doctor writes C/O, right? Instead of writing complaining of. Let's move to number B, presentation. Patients say they went to see the doctor, all right? So the patient says, I went to the doctor, or I went to see the doctor. What does the doctor say? The doctor say the patient presented. The patient presented. All right? So the doctor say, for example, the patient presented with chest pain, for example. All right? The symptom which causes a patient to visit a doctor or to present, right, is called presenting symptom or presenting complaint or presentation. Let's have an example. For example, we say his presenting symptom was chest pain, or his presenting complaint was chest pain. Or we say he presented to his general practitioner with chest pain. GP is abbreviation for general practitioner. Or you say the usual presentation is chest pain. So again, this part, we say that a patient went to see the doctor. And the doctor say the patient presented. The patient presented. What's the meaning of the patient presented? It means that the patient went to the doctor. The problem that the patient suffered from are called presenting complaint or presenting symptom or presentation. All right, let's move to number C. Talking about symptoms. These are some of the symptoms that a patient may suffer from: tiredness, lethargy, fatigue, lassitude. All of these words, they mean loss of energy. They mean loss of energy. Tiredness, lethargy, fatigue, lassitude. The patient, for example, presents to the doctor saying, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. So, all of these words, feel tired, feel worn out, exhausted. Here the H is silent. H is silent, so we say exhausted. All of these words, they mean loss of energy. Malaise means general feeling of being unwell. It means feeling unwell, like when the patient presents to the doctor saying, I feel unwell, I don't feel well, I've been feeling off color, off color. This expression means feeling unwell, referring to the symptom which is malaise. I haven't been feeling myself. I haven't been feeling myself. This is another expression. تعبير تاني. I've been out of sorts all day. I've been out of sorts all day. All of these expressions, they refer to or they mean feeling or being unwell. We have the third symptom, which is anorexia. What is the meaning of anorexia? It means loss of appetite. Loss of appetite. not being able to eat, not being able to eat. My appetite is very poor, or I've been off my food for days, off my food for days, which means that I don't eat my food anymore these days. I don't eat well. I don't eat well. Another symptom is weight gain, increase in weight. Saying I've put on 8 kilos in the last year, or saying I've gained 5 kilos. Weight loss, the opposite of weight gain, is weight loss, which is decrease in weight. I'm not eating any less than usual, but I've lost a lot of weight recently. Constipation is the last symptom we have here. Constipation. It means hard or infrequent feces. Hard or infrequent feces. My motions, you can say, like in common English, my motions are very hard, or I've been quite constipated lately. I'm not very regular, referring also to the constipation or the hard feces. Here, complete the table with the words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you, like here, exhaustion. All right. So the first thing that we will take, what is the meaning of stress? Stress or stressed syllable, they affect the pronunciation, all right? Like, for example, what is the difference between comment, the verb, comment, the verb, and comment, the noun? Comment and comment. Here, the difference is in the stress. When we say comment, the stress is here. When we say comment, the stress is here. Again, this word consists of two parts. Part 1, come, and part 2, meant. All right? In the verb, the stress is on the second part here. So we say comment. What about here? In the noun, the stress is on the first syllable. We say comment. All right? So here we will say what is the adjective, and then we will say where is the stress. The first one, exhaustion. The adjective is exhausted. Exhausted. Where is the stress? The stress is here. All right? What about fatigue? The adjective from fatigue is fatigued. Where is the stress? The stress is here on the second part, fatigued. Right? And here also, the stress is also in the second part. The next one is lethargy. Lethargy. When we say lethargy, where is the stress? The stress is on the first part, lethargy. What about the adjective? In the adjective, the stress is on the second syllable, the second part. We say lethargic, lethargic. So here lethargy, here lethargic. Lethargic, all right? So the stress is on the second part. For the last word, tiredness, the stress is on the first syllable, and also in the adjective, the stress is on the first syllable. We say tiredness, the adjective, right? Sorry. The adjective of tiredness is, of course, tired. So, why this part is important? This part is important in order to take care of and to notice the difference in pronunciation between the noun and the adjective and the verb. Like, for example, between comment and comment, between lethargy and lethargic, all right? Sometimes the stress does not differ between the noun and the adjective, like in exhaustion and exhausted, in tiredness and tired, in fatigue and fatigued, all right? And sometimes um, it's different, like in lethargy and lethargic, all right? Of course, in the exam about this part, I will not tell you where is the stress of the word. مش هسألكوا على السترess, but I just want you to take care of how to pronounce it. عايزاكوا بس تشوفوا الاختلاف في النطق علشان تاخدوا بالكوا إن ساعات النطق بيختلف من الnoun والadjective أو الverb. Alright, let's move to number 14.2. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Here we have these words or this word combination. You will find them here in this table, all right? You will be asked about, for example, the expression worn out or wear out, and off color, and out of sorts, off my food, put on, and so on. All right. So here we say complain, complain of, complain of. We say of color. We say out of sorts. We say present with. We say put on and worn out. So here, complete the sentences with the correct form of the verb present. Of course, this part is important, all right? Let's move to this exercise. Complete the sentence with the correct form of present. We will say sometime present, and sometime we would say presenting as an adjective, and we will say the noun presentation, all right? So we will answer with present, presenting, or presentation. Number 1, a 67-year-old man blank with a 9-month history of increasing shortness of breath. So here, of course, will be verb. So we will say presented. Number 2, the most common what is loss of consciousness. Here we will use noun. The most common presentation. Number 3, Cranial arteritis. What is the meaning of cranial arteritis? As we said, arteritis, the prefix arter means arteries, and itis means inflammation. So here it means inflammation of the arteries that that supply blood to the head and the brain. So it's the inflammation of the arteries that supply blood to the head and the brain. Uh, Cranial arteritis may present. May, after may comes the verb in infinitive, so it will be may present. Number four, the patient usually, here will come verb in the present simple because of the keyword usually. So it will be the patient usually presents with a severe sore throat. Number five, the what symptoms in this patient could perhaps be due to renal failure. Here, of course, will be um, uh, adjectives, so it will be the presenting. As you said, we say the presenting symptoms or the presenting complaints. And as we said in the first lecture, that REN, the root REN means kidney. Uh, Renal failure refers to the failure of the kidney. Other conditions with a similar what include acute. Acute means that is not that is for short time, uh, and cholecystitis means inflammation of gallbladder. So here it will be other condition with similar presentation include acute. As you said, acute means for short time, and cholecystitis means as we said, status here. Itis here means inflammation. So cholecystitis means inflammation of gallbladder, which means in Arabic المرارة. Reduced growth is an important presenting complaint of colic disease. 2 months following presentation, the patient was able to walk. All right, let's move to 14.4. Read the patient description of her symptoms, then complete the case report. So this is how, in this first extract, the patient is describing in general English how he or she feels. And here is the case report. We will turn it into medical language. I was well until a few months ago. In the beginning, I just felt off color and a bit tired. But lately, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. So here, when we turn this general speaking language into medical language in order to write it in the case report, we say a 50-year-old housewife who had been unwell until 4 months previously. What of tiredness? Here the answer will be complained. Complained of tiredness. As we said in this example, complain of, complain of. So here we will say complained of tiredness, and she said many keywords that means that she is feeling unwell. Like, for example, I felt off color and a bit tired. So here, a complaint of tiredness and malaise. She had what 9 kilos. So she had gained 9 kilos in weight in the year before she went to her general practitioner. In the year before she presented to, we say presented to. Of course, or presented with. We say present with and then the problem, or we say present to the doctor, all right? So she presented to her general practitioner, although she denied eating more than usual. She was wet and she noticed that her hair had started to fall out. Here she say my motion, so she was constipated. And she noticed that her hair had started to fall out. All right. This lesson mainly focus on the symptoms and the signs, and how to express them in medical terms. All right. Let's move here into two-word expressions. This part also is related to the pathology and some of the diseases. All right. We will match here between A and B, and then we will answer the blank here. These blanks are the definition of this word. Like, for example, we have here a heart attack, right? What is heart attack? Heart attack is a condition in which the heart has a reduced blood supply because one of the arteries become blocked by a blood clot. What is the meaning of clot? Clot means mass or lump. All right. Causing myocardial. What is the meaning of myocardial? As we have taken in the first lecture about medical terminology, myo means muscles, referring to the muscles, and cardio or cardi means heart, and al means pertaining to. So this word means pertaining to the muscle of the heart, which also which refers to, if we didn't take it as a literal meaning, it means the tissue, um, the muscular tissue of the heart. So this word means the muscular tissue of the heart. All right. Um, a condition in which the heart has reduced blood supply because one of the arteries become blocked by a blood clot, which means mass or lump, causing a myocardial ischemia. What is the meaning of ischemia? Ischemia is a condition in which the blood flow and thus oxygen is reduced or restricted in a part of the body. Alright, let's write it and say it again. We can write it here. Ischemia, or sometimes it's written with only E instead of AE, it's written with E, alright? What is the meaning of this word? It's a condition in which the blood flow and thus oxygen is reduced or restricted in a part of the body. Alright? So when we say causing myocardial ischemia, it means that the blood has been stopped or reduced, decreased. Okay, the blood flow is decreased or reduced. That is going to the muscular tissue of the heart. يعني تدفق الدم اللي بيروح للmuscular tissue of the heart, the myocardial tissue has been reduced يعني قل تدفق الدم قل. Alright? This is called heart attack. This is a heart attack. Alright? And we have alright, and the myocardial infraction. What is the meaning of infraction? Infraction means tissue death. Infraction means tissue death due to the inadequate blood supply. Because of course, when the blood flow is reduced, also the oxygen will be reduced, right? A substance given okay. So first we will match between number A and number B. The first one we said heart attack, all right? Uh, so let's begin from the first one. We say allergic. We say allergic what? We say allergic reaction, all right? So here it is. Allergic reaction. And we say here balanced diet. Balanced diet. Allergic reaction and balanced diet. We say bedside manner. Bedside manner. All right. We say biological clock. Biological clock. And we say bone marrow. Bone marrow. And we say brain death. Brain death. And then we say clinical trial, clinical trial. Digestive system, this is an easy one. General practitioner, general practitioner. And we also say general anesthetic, general anesthetic. And this is heart attack. And we say malignant tumor, malignant tumor. Plastic surgery and primary tooth and surgical intervention. Alright, so let me say it again. We say allergic reaction, balanced diet, bedside manner, biological clock, bone marrow, brain death, clinical trial, digestive system, general anesthetic, general practitioner, heart attack, malignant tumor, plastic surgery, primary tooth, and surgical intervention. So let's read these definition and then we will fill out the blank with one of these compound words. Uh, so for example, a substance given to make someone lose consciousness so that a major surgical operation can be carried out. This is, of course, the general anesthetic, البنج الكلي, general anesthetic. All right. Number 3, soft tissue in cancellous bone. Soft tissue in cancellous bone. What is the cancellous? When we say cancellous bone, it means spongy bone. What is a spongy bone? This is one of the internal tissue of skeletal bone. All right. Let me write this definition here. When we say cancellous bone, this refers to the spongy bone, which is one of the tissue. It's an internal tissue, نسيج داخلي of skeletal bone. Alright, so soft tissue in cancellous bone, this refers to the bone marrow, which is in Arabic النخاع العظمي. The treatment of disease or other condition by surgery, of course, the answer will be surgical intervention. Number 5, any of the first 20 teeth which develop in children between about 6 months and 2.5 years of age and are replaced by the permanent teeth at around the age of 6. So what is the opposite of permanent teeth? We have the primary tooth. The primary tooth. All right. They are replaced by the permanent teeth. Number 6, surgery to repair damaged or malformed parts of the body. Of course, malformed means misshapen, that there is something wrong in the shape, right? So this is will be plastic surgery. Number 7, a condition in which the nerves in the brain stem have died, and the person can be certified as dead, although the heart may not have stopped beating. This is the brain death. Number 8, the way in which a doctor behaves toward a patient, especially a patient who is in bed. This is bedside manner. Number 9, an effect produced by a substance to which a person has an allergy, such as sneezing or skin rash. Of course, allergy, uh, what okay, this is of course what happen if someone has an allergy towards something. It will be called the allergic reaction, the effect produced by a substance to which a person has an allergy, such as sneezing or a skin rash. It will be allergic allergic reaction. Number 10, a trial carried out in a medical laboratory on a person or on tissue from a person. This is called clinical trial. Clinical trial are trials or experiments that has been done in the laboratory. A tumor which is cancerous and can grow again or spread into other parts of the body, even if removed surgically. This is the malignant tumor. And the opposite of the malignant tumor is benign tumor. We will take it later. Number 12, a doctor who provides the first line medical care for all types of illness to people who live locally, refers them to hospital if necessary, and encourage health promotion. Of course, this is the general practitioner. Number 13, the rhythm of daily activities and bodily processes such as eating, defecating, or sleeping, frequently controlled by hormones, which repeats every 24 hours. This is our biological clock. The biological clock that organizes everything, the eating, the sleeping. Number 14, the set of organs such as the stomach, liver, and pancreas, which are associated with the digestion of food. Of course, this is digestive system. Right. Number 15, a diet that provides all the nutrients needed in the correct proportions بالنسبة الصحيحة This is the balanced diet, right? Let's move to this exercise. The opposites. Here we will find the word and we will get the opposite of the word from this column. So we have the opposite of back is front. The opposite of acute. Acute means what? It means lasting for short time. So the opposite of acute is chronic. Chronic means continuing or occurring again and again for a long time. It means continuing or occurring again and again for long time. The opposite of dead, of course, is alive. The opposite of improve is deteriorate. The opposite of healthy is ill. The opposite of open is closed. The opposite of major is minor. The opposite of reduce is increase. The opposite of smooth is rough. The opposite of benign is malignant. As we said in the previous page, that malignant means cancerous tumor and benign means mild, right? That it's mild, meaning that if we are referring to a tumor, mild means that it's not cancerous. So we will use these vocabulary. We have 20 vocabulary. We will put them here in these gaps. All right. We have here 10 gaps. We will choose from these 20 vocabulary 10 vocabulary. All right. For example, she had an what attack of shingles. What is the meaning of shingles? Shingles is a viral infection that causes a painful rash. It's a viral infection that causes a painful rash. So she had an acute because here an, so the word comes after it will be vowel. We can't say chronic, we will say acute. All right. He became excited, causing his pulse rate to increase. When we are excited, our pulse rate, what happened to them? They increased. He was very ill, but now his condition has begun to improve. The calf muscles are at the of the lower leg. Of course, the calf is at the back of the lower leg. She put cream on her hands, which were what from heavy work, which were rough from heavy work. The tumor is what and so may reappear even if removed surgically. Of course, here will be malignant. Number 7, the hospital is what to the visitors from noon to 5 o'clock. So it will be closed. The doctor arrived too late. The patient was already dead. There is nothing wrong with you. You are completely healthy. He had to undergo what surgery on his heart? He has to undergo major surgery to his heart, on his heart. This is for our lecture today. Goodbye.